Good morning, student. In our last video, we are discussing about sports medicine. Sports medicine, it is a branch of medicine that deal with diagnosis, treatment, and prevention of injury related to sports. And first aid means treatment. So first aid means the first treatment given to the victim before the arrival of the doctors. So first aid means the immediate or the temporary cares given to the victim without the arrivals of the doctors, so that further injury can be prevented. Sports injury, it is classified into two types: soft tissue injury and hard tissue injury. Soft tissue injury means those injury, um, soft tissue injury, soft tissue injury occurs. It is again two types: skin injury and muscle injury. Skin injury means injury over the skin like contusions, abrasions, lacerations, and muscle injury like muscle tear, tendons, tears, sprain, cramp, etc. And hard tissue injury means those injury related to bones, damage to bones of skeletal system like fracture, dislocations, etc. And hard tissue injury is also classified into two types: minor injury and major injury. Minor injury means those injury which are less painful and does not affect to the performance of our players. If you do rest, um, it caused due to overuse of the affected part. If you take rest, it will heal. And serious injury, it is more painful and it affect the performance of a players. In serious injury, there is a ligament tears, muscle tear, etc. Next topic is management of soft tissue injury. Soft tissue injury, first is contusion. Contusion, it is an injury over the skin caused by direct hit by any external object without breaking the continuity of the skin. Okay, contusion, it is a skin injury caused by direct hit by any external force. In contusions, there is a pain, swelling over the affected part, and the color of skin changes from red to blue, etc. And sometimes there is a loss of function of the affected part. And the first do a cold compression, use ice. First treatment is ice application of ice for a short interval of time and for 2 days. Apply antiseptic cream if there is bleeding. Apply cold compressions after every 6 hours for 2 days, and after 2 days do massage, etc. to reduce the pain and swelling. Next is abrasion. Abrasion, it is also the skin injury. It is the injury over the surface of the skin. Abrasions, it is a rubbing of skin over the hard and rough surface. When the skin is rubbed over the hard and rough surface by a frictional force, it causes abrasions. During abrasions, it causes severe pain and sometimes the bleeding occurs at the affected part. This is the abrasions. Okay, the rubbing, the skin is rubbed in some hard and rough surface by a frictional force. The first This injury, this abrasions is mainly occurs in knee, elbow, palm, etc. And the first thing is avoid the furthest frictional friction. Clean the skin with some antiseptic cream like Dettol, Savlon, etc. and wash it properly to prevent infection. If the skin is tears, if the skin, if the it tears the tissue in the body by the sharp object, it may be internal or external. An incision injury, the injury is torn out and the wound is open. Okay, so in abrasion, the first step is clean the affected part by clean waters and with some antiseptic cream to prevent infections, and after cleaning the skin, use some antiseptic cream. Laceration and incision. Lacerations and incisions are also skin injury and are caused as a wound. Laceration is a type of wounds that happen when the tissue, that is skin and muscles in the body, are torn. Laceration, it is caused by a blunt object and it is deep. It results in outlet of internal organs. And incision is also a type of wound. It is caused by the sharp edge object like knife, razors, etc. And sometimes arteries or veins may be cut and blood usually come out freely from the incision. This is the laceration. It is a wound over the skin or the muscles caused by a blunt object. And incision is cut. It is a cut by a sharp edge object like knife, razors, and it is deep and the blood is freely come out from the incision. And the first aid and management of laceration. First step is clean the surface of the affected part by some antiseptic cream such as Dettol, and after cleaning the surface, stop bleeding at the earliest by compressions or pressing or put the compression bandage. So first clean the affected part by some antiseptic cream, and after cleaning stop the bleeding by compressions or pressing or put compression bandage so that the blood stop. Okay, stop the bleeding by compressing with the help of thumb or by the bandage. Cover the affected part with a medical cotton's bandage or apply bandage. Third step is cover the affected part by some medical cotton's bandage or apply bandage. To avoid the infections, repeat the dressing over the wounds. If the bleeding is continue, then apply further pad or dressing, and last apply ice or the cold compression for some time. If the injury is deep, go for the stitches at the earliest and avoid infections by putting medical cream over it, and care should be taken till the injury is totally healed. This is the treatment for lacerations and incision. Laceration it is caused by a blunt object, and incision is caused by a sharp edge object like knife and razor. The treatment is first clean the affected part, that is clean the surface with some Antiseptic cream. After cleaning, stop the bleeding by compressions or by putting the compression bandage. Cover the affected part so as to prevent infection. Use dressing. Repeat the dressing. Apply cold compressions. Apply the cold compressions, and if the injury is deep, go for stitches. Avoid the further infection by putting medical cream over it, and proper care should be taken till the injury is totally healed up. Next is muscle injury. Muscle injury, that is cramp. Cramp is an inability of the muscles to contract properly, causing severe pain over the affected part. What is cramp? Cramp is the inability of the muscles to contract properly. It caused due to overstretching of the muscles or loss of body waters by sweating or physical activity during sickness, lack of bodies, salt or minerals, physical activity during extreme bad weathers or climate, or not performing warming up. These are the some reason for the cramp. Okay, cramp means inability of the muscle to contract properly, and it causes severe pain over the affected part. Means the unbalanced contraction of the muscle. The muscle is not able to contract properly. In cramp, it causes inability of the muscle to contract properly. The cause of cramp is due to overstretching. If you overstress the muscle, it leads to cramp. Or if you do the exercise without doing proper warming up, it causes cramp. Or if there is lack of salt or minerals, lack, or if there is less waters, loss of body waters, it causes cramp. What are the first aid and management of cramp? The first is complete rest to the affected part. Usually for muscle injury, the first aid treatment is rest. Okay, for muscle injury, whether it is cramp, strain or sprain, the injury for muscle and the treatment for muscle injury is rest, ice, compressions, elevations and rehabilitations. This is the first aid treatment for muscle injury. So for a cramp, first step is complete rest to the affected part. Do not move. Do a complete rest. Drink sufficient waters. Stay lemon waters. Drink sufficient waters and massage over the affected part for some time. No, don't do massage. First is complete rest over the affected part. Use cold compressions. Use ice cold compressions over the affected part. If the pain is more, apply cold compressions and preventing overexertions of muscles in excessive hot or cold climate. Okay, first for cramp, the first step is do a complete rest, avoid further movement, drink sufficient waters, massage over the affected part, use cold compressions, use ice for some time. Next is strain. Strain means muscle pull. Strain, it is also known as muscle pull, that is tearing up muscle. Strain, it is also known as muscle pull. It is the injury of the muscles which is caused by overstress of the muscles or tendons or due to violent pull. That is, strain means tearing up muscle or the tendons. It is due to if the muscle is overstressed or due to violent pull, it causes strain. This violent stress of muscles, if the muscle is stressed beyond its normal limit, then it may lead to strain. In strain, muscle fiber get damaged. It causes acute pain around the affected part, loss of function, sometimes the function of the injured muscles, loss of function of the injured muscles, local inflammation, swelling over the affected part. Mild strain is also known as cramp. It can be prevented by performing proper warming up and avoiding the jerky movement or action. So, what is strain? Strain is tearing of muscles, or it is muscle pull. Okay, strain, it is tearing up muscle or tendons. It is in strain the muscle fibers. Strain, it is due to the overstretching of muscles beyond its normal levels. The muscle fibers, and strain, the muscle fiber is damaged and it causes acute pain, loss of function of the muscle fibers, local inflammation, swelling, etc. So, before doing any activity, do a warming up, avoid jerky movement to avoid the strain. And how you will first aid, the treatment and management of strain are rest, ice, compressions. The management of muscle injury, rest, ice, compressions, elevations, rehabilitation. So, the first step is rest. Complete rest. Don't move the affected part. And after that, apply ice. Apply cold compressions or ice over the affected part to stop the bleeding. Ice helps to stop the internal bleeding. Repeat this process for several times after some intervals. Use ice for 2 days. Okay, if you do icing, it stops internal bleeding. Due to strain, it may lead to internal bleeding. If you apply ice, it helps to stop the internal bleeding and reduce your pain. Compressions. Use compression bandage over the affected part to reduce the swelling. Compression means press the affected part by some compression bandage, etc. Elevate the affected part above the level of the heart by the spleen or support. The affected part should be elevated, means rise the affected part above your heart levels. After 2 days, use inflammatory cream to reduce the swelling and give gentle massage to reduce the swelling, or you can do hot and cold bath, massage, etc. And after the treatment is over, the complete regain is gained by rehabilitations. After the complete recovery of the injury, do a rehabilitation exercise. Rehabilitation is done to regain the strength of the muscle. And you can also do some exercise of physiotherapy. It is also refers as price. P means protection. First, do protections. If protections, rest, ice, compressions, elevations, rehabilitations. This is the management treatment for strain. Strain means tearing up muscle. It is also known as muscle pull. The muscle is in strain. The muscle strain means tearing of muscles or tendons. It causes due to overstretching of muscle beyond its normal levels, or due to jerky movement. Sprain Sprain, it is the injury of the ligament. Strain is the injury of muscle, and sprain is the injury of the ligament. Ligament connect bones to bones, and during sprain the ligament is tear. Okay, sprain, it is the ligament injury. In sprain, the ligament is tears. It occurs due to overstretching of ligament. If the ligament is overstressed, or due to twisting of joint, then it may lead to tearing or damage of ligament. This is known as sprain. Sprain means ligament injury in which the ligament is damaged or tears due to overstretching of ligament or due to twisting of joint. If the joint is twist, the ligament may be tear. And sprain injury, there is ruptures of ligament or tendons. Sprain is very painful and it restricts the movement of the joint, because ligament is between your joint. If the ligament is damaged, it restricts the movement of the joint, and there is a swelling, lot of pain, swelling over the joint, bleeding. It may be internal bleeding. And sprain is mainly occurs in knee, ankle, wrist, elbow, etc. So to avoid the sprain, do a proper warming up exercise and avoid the jerky movement. First aid. The treatment for sprain, it is same as strain, that is rise, rest, ice, compression, rehabilitations. The first is complete rest. Do a rest, complete rest. Restrict the movement of the joint immediately. And after rest, this is the treatment. Rest. For rest, complete rest. Then use ice. After ice, do a compressions of the affected part by some bandage. And elevations means rising of your leg or affected part above your heart levels. So the treatment is rise. The first step for treatment of sprain is rest. Do a complete rest. Restrict the movement of the joint immediately. And after that, use cold compressions, use ice over the affected part to stop the internal bleeding. Do this for 2 days. Repeat this process for several times after some intervals of time for minimum 2 days, and put compression bandage over the affected part. The compression bandage should be applied to reduce the swelling. Elevate the affected part over above the level of the heart by the spleen or the support. After 2 days, apply inflammatory cream to reduce the swelling and give gentle massage to the affected joint. Or you can also perform hot and cold bath to reduce the swelling. After the treatment is over, the complete recovery is gained by rehabilitation. Rehabilitation is done to regain the strength of the joint. So, after the treatment, do a rehabilitation exercise or physiotherapy to regain the strength of the joint and muscle. And this should be done in a progressive manners. Okay, step by step, from simple to the complex. First simple exercise and then hard exercise. It should be performed in a progressive manners. This is the treatment for sprain. Next is heart tissue injury. Management of heart tissue injury. Heart tissue injury means bones injury, that is dislocations and fractures. Bone injury. Bone injury is a serious and very painful. If the bone injury is not handled properly, it may lead to permanent disability. Okay, so it should be handled only by the expert doctors. Okay, heart tissue injury means bones injury, and this bones injury must be handled only by the expert doctors, otherwise it may lead to disability, permanent disability. And the first step for bone injury is immobilize the part, complete rest, don't do any movement, and use eye to stop the internal bleeding. In this way, the further damage can be avoided. Bones injury can be classified as dislocations or fractures. So, you can, the first step is immobilize, stop the movement, and use ice. That is ice therapy or cryotherapy. Further damage can be avoided, and bones injury can be classified as dislocations and fractures. Fractures, it is various types: simple fractures, complete fractures, compound fractures, gristy fractures, etc. First is dislocation. Dislocation, it is an injury of the joint in which the adjoining bones are displaced from their original positions. Okay, in dislocations, the joint is displaced from its original positions, and dislocations is mainly caused due to direct or indirect impact over the joint. Dislocations, it may be simple dislocations, fracture dislocation, or complicated dislocation. So, what is dislocation? In dislocations, the adjoining bones is displaced from its original positions. Okay, the joint, the bones is displaced from its original positions. Dislocation is commonly occurs in throwing game, jumping event, and it can be prevented by strengthening muscles, by doing the strength exercise of the muscles, performing proper warming up, controlling aggressive range of movement, avoid the excessive range of movement of a joint, avoiding jerky movement, etc. And the treatment for dislocation is, first is, do not move the affected part, do not move the joint, immobilize, and it should be placed in a comfortable positions. And after that, apply cold compressions, that is apply ice to stop the internal bleeding. Provide the affected part with some by using the splint bandage affected part so as to avoid the further movement. And the patient should be handled only by the expert doctors. The x-ray and other diagnosis should be done, and then this mobility should be done for 3 to 6 weeks, and after that the rehabilitation exercise should be done to regain the strength of the bones. This is the treatment of dislocation. Dislocation means the bones is displaced from its original place. Therefore, whenever you do any activity, do a proper warming up. Avoid excessive range of movement over the joint, avoid jerky movement, etc. Next is fracture. Fractures means breaking of bones. Fractures, it is the injury of the bones by some external pressures. It may be slight breakage or complete breakage of bones. Okay, in fractures is due to some external force in which the bones is cracked or break completely, slightly break or completely break. Fractures, if the incomplete or wrong treatment of fractures is very dangerous and it should be handled by the expert doctors. And the first step for fractures is also stop bleeding. For stop bleeding, use ice. First is immobilizations of the bones, complete rest. After that, use ice to stop the internal bleeding and take the victim to the hospitals. Fractures categorized into two parts: closed fractures, open fractures. And fractures, it is also there are various types of fractures like fractures like complete fractures, incomplete fractures, gymnastic fractures, comminuted fractures, impact fractures, oblique fractures, transverse fractures, stress fractures, compound fractures, and complicated fractures. These are the various types of fracture. We will discuss about the type of fractures in our next video. Thank you.